Let's talk a little bit about hospitals. They are overburdened with little to no capacity to assist incoming patients. This as the threat of the third wave intensifies. Concerns now have been raised over 100,000 new cases being recorded in the last 7 days. General practitioner from Gauteng General Practitioners Collaboration, Dr. Daniel Israel, joins me now to discuss this and look at exactly what government response has been in combating this pandemic. Thank you so much for joining us this evening, Daniel. We're talking now about a significant surge in COVID-19 infections. We do know also that we've got this Delta variant that we're dealing with. Has government been proactive enough in addressing this COVID-19 pandemic thus far from the doctor's perspective?
So, Faith, it is very much from the doctor's perspective that I speak. Obviously, I can't speak as a politician or, those aren't the sectors that I'm in. But from a medical perspective, we certainly, I think, feel quite disappointed in the proactiveness of government, because we are sitting with an influx of cases that we believe could have been prevented had we clamped down a little bit earlier. So I must say there's a lot to discuss there.
Yeah, we'll go back to this matter about government and the adequate measures that should be taken now. But when we're looking at this variant, just take us through exactly what do we know about it, Doc?
So we all know that there's an alpha, beta, gamma, delta variant. This is the delta variant. This is the variant that started in India. In South Africa, we had our own beta variant. And now we're finding that in KwaZulu-Natal, where they do a lot of research as to the specific gene typing of the variants, that we're seeing a lot of delta variant cases in South Africa. The significance of this, Faith, is that we know that in India, we certainly saw what the Delta variant did there in terms of how infectious it was and how many people it affected. And we also know that it has different characteristics to the Beta variant, which is the one that's been predominantly in South Africa. And this now will have an influence on how we behave because of that.
Yeah, some statistics coming out even from the UK indicated that the possibility of hospitalization within 14 days of testing positive is quite high. With that in mind, how much of an impact will be felt by hospitals because of this Delta variant?
So we're already feeling a large impact. As we've discussed before, the Gauteng beds are full. There really is very little hospital capacity at the moment. The important things to know with the Delta variant are it's more infectious. We see complications sometimes later. And because of the greater infectiousness, when people are together, they don't necessarily need to have 10, 15 minutes of exposure to one another to catch it. So we are likely to see a big uptake in cases because we're now dealing with the Delta variant.
Yeah, and the possible effect on the population if the spread is not contained, what are we looking at now?
So if the spread is not contained, obviously we will deal with we don't necessarily know that the Delta variant is more deadly, but given the fact that if we presume that it's similar to other variants, when there are so many more cases, we're still going to have many, many patients who need oxygen, high care and ICU and don't have beds. So, to answer your question on the whole population, we could well get into a health crisis, which we're already getting into in Gauteng, where we can't give people their needs because it's a different variant and spreads quicker. Let's
turn our attention to you guys, you in the front line who have to deal with this, who have to see us patients on a day-to-day basis. What impact is that having on you guys psychosocially? How are you guys coping psychologically?
So I work in an outpatient environment, and my outpatient environment is still very saturated with COVID cases on a daily basis. It's been great, the amount of public awareness, and that a lot of patients do telemedicine and phone in and don't necessarily come into doctors' rooms when they have COVID, which we must tell the population not to do, but still to seek out medical help.
Yeah.
We're seeing cases every day, and we really, if you look especially in the in-hospital environment, and I suppose the outside GPs and nurses, etc., we are overwhelmed by the number of cases we're seeing on a daily basis. It's a total scramble to be able to look after patients at home who might otherwise have been admitted had the facilities allowed for it.
Dr. Daniel, what should the adequate and effective response from government be to tackle this variant, to tackle this pandemic and the way that we're in?
Because that's the golden question for tonight, I think, on all fronts. But my answer to that is the golden bullet here is vaccination. This country needs to be stepping up a much higher rate of vaccination for people from a much younger age. Now, given the fact that we haven't done that yet, or it hasn't been able to be done yet, we need to be able to clamp down on people's social interactions until the numbers are down that the healthcare facilities can cope and vaccination can be rolled out. So clamp down, vaccinate, and in the meantime, all the social measures.
Yeah. Speaking about social measures, would limiting interprovincial travel actually help in containing the spread?
So we've seen with this Indian variant that as much as countries have tried to contain the spread, it's been impossible. There's already the Indian variant, or should call it the Delta variant, identified in over 85 countries. But so I don't really believe that stopping interprovincial travel will stop the Delta variant from getting to other areas. But certainly the movements of people from a social perspective and, crowds, we shouldn't be talking about 50 people in a crowd, 100 people in a crowd. We should be just saying no crowds. This is the time to stay home and just to do necessary work and, only that which is absolutely necessary in terms of interaction with other people.
I hear you. Dr. Daniel Israel will leave it there for this evening, giving us the latest there on the realities that is being faced, particularly in Gauteng hospitals.